Did you stop getting mammograms? Maybe you've heard that breast MRI is better at finding breast cancer. So is it time to swap out your mammogram for an MRI? The simple answer is no. While MRI can find more cancers in certain women, mammography remains a crucial screening tool for most. In this video, we'll break down what each test does, who benefits most, and why mammograms are still the mainstay for many women. Let's start by understanding how a mammogram works and why it's recommended. Mammogram uses low-dose X-rays to create detailed pictures of the breast tissue. This technology is designed to spot breast cancers early, sometimes even before you notice any symptoms. For women at average risk, mammography is the main screening test. In fact, major health organizations recommend mammograms every 2 years for women aged 40 to 74 who are at average risk. Early detection can make a big difference in outcomes, which is why mammograms are so widely used and trusted. Breast MRI is a different kind of imaging test. It uses strong magnets and radio waves, not X-rays, to create detailed images of the breast. Usually, a contrast medicine is injected to highlight abnormal areas. MRI is more sensitive than mammography, meaning it can find some cancers that a mammogram might miss. However, this sensitivity comes with a trade-off. MRI can also pick up areas that look suspicious but aren't actually cancer, leading to extra scans and sometimes unnecessary biopsies. While MRI can find more cancers, it also finds more things that aren't cancer. This can lead to extra tests, more anxiety, and sometimes unnecessary procedures. It's important to understand that more sensitive doesn't always mean better for everyone. The extra findings can result in more follow-up scans or biopsies, which may not be needed. That's why MRI isn't recommended as a replacement for mammography in most women. Though is MRI better? Not for everyone. For women at average risk, mammography remains the standard screening tool. However, for women at high risk, like those with BRCA gene mutations or a lifetime breast cancer risk of about 20% or more, MRI is often recommended in addition to mammography. In these cases, MRI is used as an extra layer of screening, not as a replacement. Your risk level helps determine which tests are right for you. High-risk women include those with certain genetic mutations, a strong family history, or other factors that raise their lifetime risk of breast cancer. For these women, guidelines often recommend both mammography and MRI each year. The combination increases the chance of finding cancer early. But for women at average risk, mammography alone is usually enough. It's all about matching the right test to the right person. Some women have dense breast tissue, which can make it harder for mammograms to spot cancer. Dense breasts are common and not abnormal, but they do make screening a bit more challenging. In some cases, MRI can find additional cancers in women with dense breasts. However, having dense breasts doesn't mean everyone should get an MRI. The decision depends on your overall risk and your healthcare provider's advice. Screening decisions aren't one size fits all. If you have dense breasts, your doctor will consider your age, family history, and other risk factors before recommending an MRI. The goal is to find the right balance between benefits and risks. For most women, mammography remains the main tool, but MRI can be added for those who need extra screening based on their individual risk profile. MRI is so sensitive, why not use it for everyone? The answer is that more sensitive doesn't always mean better. MRI is more expensive, takes longer, and usually requires a contrast injection. It also produces more false positives, meaning more women end up with extra tests or biopsies for things that aren't cancer. Mammography, despite its limitations, has strong evidence supporting its role in breast cancer screening for most women. Mammography has been the backbone of breast cancer screening for decades. It's quick, widely available, and effective for most women. While it doesn't catch every cancer, it's the best tool for average-risk women. The evidence shows that regular mammograms save lives by catching cancer early when it's most treatable. That's why it remains the main screening test for the majority of women. No screening test is perfect. Mammography can miss some cancers, especially in dense breasts. MRI, on the other hand, can find more cancers but also leads to more false alarms. That's why doctors weigh the pros and cons of each test based on your personal risk. The goal is to maximize early detection while minimizing unnecessary worry and procedures. Oh, should you stop getting mammograms just because MRI can detect more cancers? Not necessarily. The best test for you depends on your age, breast density, family history, genetic risk, and personal medical history. It's not just about which test is better, but which screening strategy fits your risk profile. Your healthcare provider can help you make the best choice. Medical decisions should always be based on your individual risk and the guidance of your healthcare professional. Don't just ask, which test is better? Instead, ask, which screening strategy is right for my risk? This approach ensures you get the most benefit from screening while avoiding unnecessary tests and anxiety. Sum up, mammograms remain the main screening tool for women at average risk. MRI is a powerful additional tool for women who need high-risk screening, such as those with genetic mutations or a strong family history. The best test is the one that matches your personal risk factors and medical history. Always discuss your options with your healthcare provider to make an informed decision. Key takeaway is that breast cancer screening isn't about choosing one test over another. It's about finding the right approach for your unique situation. Mammograms and MRIs each have their place in breast cancer detection. Work with your healthcare provider to determine the best screening plan for you based on your risk and medical history. Stay informed and proactive about your health.